welcome everybody. Like I said, my name is Leanne Chubuff. I'm the Vice President of Technical Affairs at SQF, and welcome to our webinar regarding the current situation. We wanted to provide you updates for our food producers and retailers and the impact of COVID-19. So we appreciate you all taking the time to listen to us in this hour presentation. Here are our presenters today. We are extremely more than 6 feet apart for sure. Hillary is based in Virginia, and I am in my home in Chicago. We have been, like some of you, not all of you, been doing some distance working. But I appreciate Hillary taking the time out today to present on the topic. So Hillary Tesmar is our Chief Food and Product Safety Officer and SVP at FMI, the Food Industry Association, and she is our guest presenter today. So the Food Industry Association, or FMI, is the parent organization of SQF. So we're very fortunate to have Hillary on staff, and I can't appreciate Hillary more than during this crisis, because she has just been a rock star with the information that she has developed and is sharing with all of the members and with even non-members and especially with SQF. So I am really lucky to have her as a colleague and very fortunate that she can take some time out and present to us today. But Hillary, like I said, is our Chief Food and Product Safety Officer and SVP at FMI. She is the leader over the food and product safety as well as health and well-being, including developing all of the strategies and priorities at the retail level and support and technical support for members and our programs to promote the state of the industry. So a bit of background about Hillary is she's a graduate. She got her PhD in food technology from Clemson University. And she also has a Master's of Science in Human Nutrition from Winthrop University. She is very active in many organizations, specifically IFT, IESP, and the Academy of Nutrition and Dietetics. So we're very fortunate. And like I said, during a time of crisis brings out character, and Hillary has really shined for us at FMI. So just a little bit about SQF before we begin. This is our technical team. Myself, Bill is based in Australia, Tammy Van Buren, who is based in Kentucky, Frank Shears, who's based in Canada, and Christy Grzywinski, who's based in Chicago as well. So we all have a valuable part in building what the SQF program is all about. But we're not alone. We have a lot of global support because we are a global program, and we have our global team in Australia, Colombia, Brazil, Japan, and China, and we all provide the resources that we need for SQF, especially, again, during this time of crisis. So if you don't know SQF, this is who we are. We're an accredited third-party certification. We are a product certification under ISO 17065. We are a division of the Food Industry Association of FMI. Like I said, very lucky to have FMI as our resource anyway, especially during this time. We've been very fortunate. We have a farm-to-fork solution and food safety certification designed around the GFSI industry scopes. All in all, we have 11 codes, over 30 food sector categories. We are one of the few standards that are based in North America, but we are the only standard that does offers farm-to-fork certification from primary livestock as well as produce all the way through manufacturing, storage and distribution, and food packaging. We also have codes in the retail and food service industries. And we have 10,000 sites, or 10,000 certified sites across 37 different countries. So before we begin, though, I just kind of want to get an idea of where everybody is. So we have a poll that's posted on your screen. So if you could just tell us what industry sector you're from, and then I'll move on to what our discussion is today. So today we want to learn how the food safety landscape and the supply chain is adjusted to COVID-19. We want to understand and assess the available resources that we have regarding COVID-19 and look ahead regarding the CDC and what CDC is providing to us. From an SQF perspective, we want to provide more information about risk assessments. There's been some questions from our end and how we go about evaluating our risk assessments, and understand that next wave that we keep hearing about from CDC and what we can do at SQF and how we're preparing for the future in this influx of audits that we'll be experiencing. And then also we want to talk about remote audits. So what are the pros and cons of remote audits and how can they help with the audits, not just during this time of crisis, but even beyond. So let's see where we are. So the majority are SQF certified sites, which is great to see. And then we have some retailers as well, and then some other sites that are benchmarked to a different standard, and others, there's auditors and academics, consultants, let's see, government. Excellent. Thanks for chatting that in. I appreciate that. So a lot of certified sites on the line. That's great. Alrighty, so I'm going to pass the baton over to Hillary, who she can share what FMI has been doing during this time of crisis and the resources that are available. So Hillary, I'm sending it to you.
Great, thank you so much, Leanne. So to go ahead and talk through a little bit about FMI, and I really want to focus on where to go for information and the resources. So basically, Leanne did a great job of kind of introducing SQF and FMI, and we are the trade association that really represents retail, wholesale, and product suppliers. So our job is to kind of make your day job a little bit easier and to kind of take away some of those challenges and help make your lives a little bit easier. One of the things that's really important to us at FMI is making sure that we comply with our antitrust compliance policy. And the entire antitrust policy is on the slide in front of you right now. And anytime we bring competitors together, all meetings we have to comply with this policy, but anytime we bring competitors together, which is you guys, this becomes really super important. So the policy is right in front of you. Basically, we want to avoid anything that could be an antitrust concern. If we see anything that's a concern, we will bring it up. If you have any questions, please feel free to raise them at any time. But this is required, and we feel like in transparency, we want to share the entire policy statement with you. So jumping in, Leanne shared some of the SQF team members with you. This is the food safety team at FMI. We are small but mighty. We have a couple of food scientists on the team, and we basically, will jump in and help our members with anything they need assistance with. Most of it falls in the realm of federal regulatory compliance, but anything technical is really what we spend our time on. So Ashley Eisenbeiser has been with FMI for about 6 or 7 years now. Gwen Lee's been at FMI for 20 plus years, and Adam's been with FMI for about 3 years now. So all of us are willing to help our members with anything that you need assistance with. All right, let's jump into COVID. This is a dynamic situation, changes hourly. This slide is from yesterday. It's already changed quite a bit. The latest stats are 5.6 million cases worldwide. U.S. is almost at 1.7 million. It is at 1.684 million. Brazil is the next leading country, not a list you want to be topping, unfortunately. And then Russia's behind Brazil in reported cases. So obviously, none of us thought we'd see this, but worldwide pandemic. And it's really changing, what we're, dealing with on our it's impacting our work, it's impacting our daily lives. So this is where I go for information. Johns Hopkins, based in Maryland, has amazing data analysis and tracking. So this is the dashboard that I go to. It's updated a couple of times a day, and it's open access information. So the website's at the bottom. You can Google it easily. It's a great source of information, and you can drill down to whatever you want to see. And looks like there's a poll question. Leanne, should we go to this poll question now, or is this, I think this one's for later. Yeah, we'll get to it later, sorry. Okay.
Yeah.
Okay. So the food industry priorities and challenges, there are many, just in terms of kind of putting them into some kind of list or, prioritization or organizing them somehow. Really, this has taken its toll, and we've really seen this focus on people. Employee health has come out really at the top in terms of, for the essential businesses, for businesses that have stayed open, how do we focus on people and protecting employees and people who have to be in our businesses, have to come into our businesses and work in our businesses. So employee health, customer health, and people health in general. I think that's probably the top thing that we've been focused on. We've had some real supply chain challenges, things that we could predict, things that we couldn't predict, things that we never saw coming. Supply chain has been a huge challenge over the past months, and we've learned a lot of lessons from that. The next one is consumer behaviors and customer needs. We've been tracking that. We have a little bit of insight, but that's been some real lessons learned in terms of how consumers respond, what their needs are, and how they react in situations like this. Then a fourth one, and this is kind of predicted and unpredicted, but we are very used to working in a regulatory framework of, are we regulated by FDA, or are we regulated by USDA? Are we regulated by, our in-country regulatory authority, whether it's, the Canadian Food Inspection Authority or, EFSA or whatever it is, whatever country you're in, whatever regulatory authority you're under. And the United States, public health is regulated at the local level. And that has been extremely challenging for those of us in the United States to navigate because it's fragmented. So instead of being under FDA or USDA, now we're under state, even city, county, local authorities. And it's fragmented, and it's confusing, and it's not always science-based, and that's been very, very difficult to deal with. Looking at the consumer aspect of this a little bit, we've been doing, our research team at FMI does surveys all the time, and we've been looking at kind of how people are responding. And we do this through online surveys. And we do an annual report on grocery shopper trends. But what we've been doing is throughout this crisis, we've been taking a deeper dive into a limited number of questions and looking at how consumers have been responding. And it's really been fascinating in terms of just human nature. How are people responding to this? So a huge number, 89% of people have said they've made a change in how they shop as a result of the pandemic. And when you think about this, some people live in cities, some people live out in the country, but 89% is huge to have that many people say they've changed the way they shop. 42% are limiting the number of trips to the grocery store. 25% say they are buying a narrower range of items. 33% are spending more money each visit. So they're shopping less frequently, but they're spending more each visit. They're shopping faster, which is interesting. They're not lingering in the stores. And they're shopping at fewer stores. So instead of going, we know before the pandemic, people were going to 4 to 5 stores per week. Now they're going to 1 or 2. So that's a pretty significant change. This can be downloaded for FMI members. This information is free, so you can access it on the FMI store. If you're not an FMI member, there's a nominal charge, so feel free to access that. There are some infographics and things like that that you can have access to. So just wanted to let you know we're tracking this information. We are sharing it pretty broadly through the media, so you will see snippets here and there. So the industry response has been very much to provide very focused information on things that will help the industry and members move forward. We really wanted, we know we couldn't provide everything for everyone and provide something for every single situation. We really wanted to provide very specific information that would help most people in most situations. We also knew that partnerships were going to be extremely important, and they have been extremely important, and I'll talk a little bit about that. And then we wanted to provide information for you, know where to go for resources. You cannot remember everything you read because you're reading a lot of information right now and can't remember where to go for everything. So we wanted to provide you with some kind of framework of where to go or where things are and who has what resources. So the one place I would tell you to go is FMI website. And we have a great portal. You can get to it from our page, which is the fmi.org, our webpage. And there's some key sites that are on there that are very helpful. So the coronavirus resources, and then also there's a state tracker information. That's very, very helpful. I mentioned public health is regulated at the local level. The state tracker information is going to be kind of your go-to resource to see what different requirements are in different states, different localities, those types of information. Next we have, backwards. Okay, so we have so look at the FMI resources first. Then we have Food and Beverage Issues Alliance. I mentioned partnerships. Partnerships have turned out to be just absolutely essential for those of us in the food industry. This is a group called the Food and Beverage Issues Alliance, which is a collaborative group of trade associations that represent the food industry. I bet you're a member of one of the groups that either through your company or personally you're a member of someone on this list. All of us have banded together in order to provide cohesive guidance for the food industry. And this has turned out to be incredibly beneficial and incredibly helpful. I'm going to pause. If you are not speaking, if you can mute your phone lines, that would be extremely helpful. So the website where all of this information is found is feedingus.org, and it's just feeding either us or us.org. And we have a bunch of resources, guidance documents, fact sheets, whatever you want to call them. One of the first ones that we actually came up with back in late March, early April, it's actually the second one listed on this page, is food industry recommended protocols when employee or customer tests positive for COVID-19. We have used this over and over and over again. It has been through multiple different regions, counties. It's been tested over and over again. It works. We have fact sheets. We have decision tools, testing resources for COVID. So if you need something, look here first because it's probably there. And it represents all of the associations on the list on the previous page. So cannot emphasize partners enough. They have been amazingly helpful. The next thing I want to mention is resources are very helpful, but sometimes too much is too much. CDC has been great. I mean, CDC has an amazing reputation nationally, internationally. The information they put out is just golden. It's incredible. The scientists there are amazing. CDC has put out 107 guidance documents on COVID-19 in the past 60 to 75 days. I can't keep up with that. That's a lot. Now, they are specific. Some of them are for the cruise ship industry. A lot of them are for healthcare. Many of them are for the food industry. Some of them are for daycares. But that's a lot of guidance documents, and they revise them frequently. But they are the gold standard. CDC's guidance documents are the gold standards. So you have to know where to go and how to access the information. So those are my kind of quick resource lists of where to go for the information. So it's going to be CDC, it's going to be the feedingus.org, because those are the food industry guidance documents that have been vetted through multiple scientists, through regulatory officials, other organizations. So you don't have to remember everything, but you just have to know where to go for it. The other thing I want to mention is that there has been a lot of regulatory flexibility and guidance and changes out there, and there also are a lot of other regulatory agencies that we probably haven't heard of as much that have become super important over the past couple months. The first one I'll mention is CISA, which is the cybersecurity critical infrastructure agency under DHS, Department of Homeland Security here in the U.S. They're the ones that said which industries were essential. And they came out very, very, very early and said the food industry, actually the entire food supply chain, agriculture, all the way through packaging, production, manufacturing, through retail, was essential. And that helped our industry tremendously that they came out so quickly with that. So DHS, CISA, FDA has been extremely helpful with FAQs, labeling flexibility that they've come out with. They continue with inspections that are high risk and for cause, making sure that our industry has the food safety protections that we need. USDA has labeling flexibility. They continue with continuous inspection. CDC, I mentioned multiple resources and guidance documents. And then a few others. EPA. If you have not heard of EPA List N for disinfectants, please look that up. That is the list of disinfectants that they have deemed to be effective for working against the SARS-CoV-2 virus, which is the virus that causes COVID-19. You need to know that, at least if you operate in the United States. Might be a helpful resource if you're international. OSHA, the Occupational Safety and Health Agency here in the U.S., they have a guidance that employers must follow, basically. And then the EEOC, the Equal Employment Opportunity Commission here in the U.S., is another one, and they're coming out with guidance on employee screening. So again, it kind of goes beyond the agencies that we typically work with for those of us in the food industry. So what's the future? What's going to come next? Obviously, this has changed a lot, and our jobs probably have changed quite a bit. Your job probably has shifted quite a bit over the past couple of months. What can we do now to help us out? This is just my list, but thinking differently is going to be huge. Eliminating barriers. Things that used to be barriers probably aren't barriers anymore. We might have new barriers that we need to break down. Planning for things we can expect. For example, supplier approvals. Supplier approvals might look a little different now. We have very diverse supply chains. Maybe holding additional inventories is necessary, or you learn some lessons the hard way about not having enough of some products that you needed to have on hand, or making changes of suppliers when things became harder to obtain than others if you had limited supply on hand of some specialized ingredients. Human resources and training. We've seen companies do kind of one thing or the other. It's either huge allocation of resources into training, or they kind of put it on the wayside and ignored it. So I think we're going to see a balance with human resources and training, but we've really seen an emphasis on people. we really think it's important to focus on specific areas that will make a difference. You can't do everything. You can't make everyone happy. Really focus on what's going to make a difference for you. And then I come back to this word over and over again, but the partnerships, you have to talk to your supply chain. You have to talk to your business partners. There are planned and unplanned partnerships. We have 2 examples within FMI. Pretty early on, there was a very obvious shift in the supply chain that, restaurants were closing. There was a supply chain for the basically food service supply chain, and we had this incredible demand and this shift at retail, and we were able to shift some of that supply chain, and it was a welcome thing to do on both ends. The food service folks were more than happy to find an outlet for their products. The retailers were more than happy to accept additional products, and FDA and USDA gave some regulatory flexibility to us in terms of labeling. So there was an unplanned but a very quick pivot and able to sell products that were destined for the food service supply chain, but we were able to accept them into retail and sell them at retail. Another one, which I think is just classic, is distillers. There was a huge shortage of hand sanitizer. You had distilleries making hand sanitizer. That is just, I think, just a great example of pivoting quickly, shifting the supply chain in order to do good. So those are 2 quick examples that I think are huge wins for the industry. Other partnership examples, associations, trade associations, professional associations, regulatory associations, and then also communication methods. We've completely changed how we do business, how we communicate on a daily basis. I think this will continue to shift. So I will pause there and turn it back over to Leanne.
Okay, thank you, Hillary. I appreciate it. Just as an FYI, I wasn't talking during that whole thing, so maybe people were like, hey. Okay, so we have another poll question real quick, and the question is, how do you think the current crisis will impact the future? What do you think is how you think the current crisis will impact the future? Do you think there will need to be a change in how audits are conducted? Are there personal practices at the site that will need to be modified in the future, or that you're currently doing now that you think, hey, this is something we're going to do long term? You don't think there's any anticipated changes in the future. So right now you're doing something, but you're thinking maybe moving forward, once this crisis passed, we're going to resume where we were. Or if there's anything else, then just chat that in. I'm just curious, what do you think is going to be the most significant change out there? Wow, personal practices at the site. That is interesting. Yeah, you can only vote once. So somebody was like, oh, audit and personal practices. So unfortunately, you can only vote once. But yeah, I would agree. Definitely some personal practices at the site will need to be modified. Maybe some lessons learned. And I think Hillary really put some great examples in there. I know we even got a email from an SQF certified site that was doing distillery that wanted to then make hand sanitizer. So some practices, just like you said, just pivoted and changed, and we needed to pivot quickly and move quickly and implement policies and procedures, and sometimes that's just some of the things we're not really used to. Alrighty. So it looks like mostly personal practices at the site will need to be modified. Excellent. Alrighty, I'll close that poll, and I have one more poll while I move forward with what we're going to talk about. And this one is, actually I'm not sure how you're supposed to respond to it, maybe in your chat box, or maybe, I don't know how you, okay, here we go. On a scale of 1 to 5, how has your food safety system prepared you for this current crisis? So on the scale of 1 to 5, how has your current food safety system prepared you? Thank you. Not prepared at all, very well prepared. I mean, I've heard on a scale, honestly, 1 to 5, I've heard these all, where I've heard some sites say, hey, thank goodness I was SQF certified. I am ready for this crisis. I mean, there are some things that still come out of the blue, but what are some of the things? So very well prepared. That's really good to hear. Not so well prepared maybe. And I'm just curious, I was going to put in there who had pandemic as a test for their crisis management program. And I don't know how many people would have had that. So that's good though. A lot of people think that they're have been very well prepared to like Hillary said, to shift. And I think mostly in our sanitation uses and how do we maintain good sanitation practices while making sure that we can destroy this virus in particular. So good. So what I'm going to talk about is our response to COVID-19, specifically certificate extensions. I'm going to share with you some of our auditor training because many of them have been closed or canceled or shifted to different dates. And I want to share with some precautions from auditors' perspectives on what to do when conducting audits, when coming into a site, and some of the expectations from the site of what you should be expecting from your auditor. And then also remote audits. That seems to be the new business buzzword right now is remote audits. So I'm going to talk about that for sure. So before I begin, I want to share with you the resource page that we have for coronavirus with SQF. So this is our SQF resource page. If you go right to sqfi.com, there is what's highlighted in orange that says COVID-19 resources. Click on that, and you have a direct link to the FMI resources that Hillary just shared with you. Honestly, it's so impressive what FMI has developed. And it's not just resources for retailers, it's resources for food producers, it has resources, it's that industry association that Hillary talked about, combined efforts, collective efforts of the leaders and the masterminds of food safety that put together these resources. And don't go it alone. You know, honestly, that's my biggest advice is don't go it alone. There's resources out there for you. So please you could go to our website and look at that. But on our resource page, we have the latest COVID-19 news from what's posted by FDA or CDC. We try and put it from a global perspective. So we get news from Canada, Australia, and we share that on there as well. List of all of our resources and references. We tried to pull what would be pertinent to our SQF certified sites. So we pulled that and put that on there. Our policies and procedures, specifically their extension, certificate extension policies and procedures, and then GFSI's policies on COVID-19 and remote audits. So a lot of good information. Again, don't go it alone. So here are some of the frequently asked questions that we got, and these just don't even come to the surface as to all the questions that we got collectively, even between myself and Hillary. But these are some of the questions that we got from sites and from CBs and auditors. A lot of it had to do with the certificate extensions. How can that be conducted, and what's the policies and procedures, and why is it taking so long for the CV to get a response back to me, etc. When is my registration due, and FYI, it's due annually on your original recertification audit date. So if you're a certified site, it's not when your audit is due, it's when your original audit certification is. But a lot of it is even going back to what types of chemicals can I use extra hand sanitizer? Can I use different chemicals? And really following your policies, your SQF chemical policy, making sure that it's EPA approved for use in a food establishment. So again, that's why your SQF program really does come into play here. And then even from PPE, like how can masks be used? So granted, you're not using masks for food safety, but perhaps they could be a potential threat to food safety if hands are touching the mask that then are touching the food, right? So we know for sure, or we know that there has been no indication that COVID-19 is foodborne transmitted. However, there is an opportunity when you are introducing new PPE, such as face masks, that could introduce a potential contamination if hands are touching faces and face masks aren't clean, or however they need to be used at the site. So Those types of questions have come up as well. And again, like I said, to Hillary's point, there was an alcohol beverage facility that wanted to manufacture hand sanitizer. Does this, how does this interfere, or does it interfere with their current certification? And, really that the CBs, these are questions that CBs may ask their sites. How are they using their facility? And if it's not within the scope of certification, how can I make sure that I'm following the requirements of my CB as well as my site? And then we get questions from our certification bodies and our auditors, and mainly how to conduct a risk assessment, how to handle if sites want to transfer from one CB to another, training classes, those that have participated and attended, and then the big question is remote audits. So just to give you a picture of what we've been handling with extension requests, and this is a great timeline as to when we started with extension requests back on March 5th to just recently. This was updated yesterday, so on May 26th. And you could see the ups and downs of certificate extension requests. So this means that a site is due for an audit, but primarily the reason that they can't have an audit is that their site implemented a no visitor policy, and they informed their CB, and therefore we are offering an opportunity to extend the certificate up to 6 months. So there's a process involved. I'll go into that in a little bit, but you can see that a lot of sites have taken the opportunity to say, this is a no visitor policy, or maybe an auditor can't travel to that site because CBs have specific restrictions as well. But since March 5th, we have entertained 1,200 requests, and probably that much have been approved, but 1,200 requests for certificates to be extended for 6 months. The United States is the #1 country that is requesting these extensions, followed by Canada, Australia, Mexico, and Japan, and that pretty much tops off where our key markets are. So it does make some sense, and it also kind of drives when the pandemic had hit in each of these areas. If you want to dig a little bit deeper in the United States, California California is the #1, Illinois, Pennsylvania, and you can kind of tell these are some of the hardest hit areas too. California, Illinois, I know, and New York. So a lot of these areas, but these are the top 10 by state that we've been looking at. But 1,200 requests globally. So Tammy Van Buren, our compliance manager, has been awfully busy these days looking at these extension requests. So here's our policy. GFSI's position, they had a position, and they updated it March 23rd, but basically stated the same thing. You can only extend your certificate up to 6 months, and it has to be only one-time request. So when a site requests their extension, it's for up to 6 months, and it only is for that one-time request. The risk assessment is to be conducted by the CB, and the CPO is to approve it. GFSI still to this day has not approved the use of remote audits. And if you're a new site, no certificates can be issued unless the audit is conducted in person. So our policy is just that. You can approve an extension request, but there has to be a procedure in place. So we're approving that the certificate can be extended for 6 months, but the CB has to do their due diligence to make sure that the site has the right food safety system in place. So they're looking at a historical to determine if the site is at high risk for approving that certificate or low risk for approving that certificate extension. So I'll go over that in the next slide. But the CB submits the request, and then we would approve that request. And basically, we've looked at all of the procedures that the CBs have identified and are using, and some of them are more stringent than what SQF provides. However, they still follow our protocol. We did put a waiver on unannounced audits for unannounced audits scheduled for until August 1st. So if your audit is scheduled to be conducted August 1st, then prior to that, there's no unannounced audit. I will want to say, too, that there have been no fees that have been issued by SQF to the sites or the CBs for these certificate requests. We've had some questions about that. And on average, our response time has been less than 24 hours. So you can kind of see where here's the process for it. It's not just as simple. So I guess to the retailers out there and the buyers out there that are accepting these 6-month extension, we're not just granting 6 months extension. We are truly evaluating the risk to the site to determine if we can extend the certificate or not. So we look at historical audits. What were their last nonconformances? Are they due for a surveillance audit? I mean, there's a lot of questions that that we ask, or that the CBs ask that site to determine if they're high risk or low risk in their risk assessment procedure. So they have to conduct a risk assessment really just to determine if we can extend this certificate or not. And here are some of the questions that the CBs ask. They're going to ask, you know, when will you be resuming activities or normal activities? When will you be banning your visitor requirement? You know, what is the standard for that? Has there been an overturn in management? Has this been affected? You know, have we had to lay some people off due to the pandemic, or are we using a lot of temporary staff due to the pandemic? So these are risk factors that the CB evaluates when they determine, okay, you're a low risk, we can move on and certify you. If you're high risk, there may be some remote activities, such as I need to review your latest HACCP plan, or I need to look at, you know, talk to senior management. There might be some remote activities that would mitigate and lower that risk so that they can extend it. So it depends on CB to CB, but primarily there's you know, a lot of information that the CB has to acquire before they can just simply extend a certificate. So I just wanted to tell everybody that how in-depth we go into for these extensions. So just to provide you a little bit more information how SQF has been impacted, we know we need to get more auditors out there. We know because we have 1,200 audits that have been extended, and that's going to all come to us at one time. And so there's going to be this huge wave. Unfortunately, person-to-person training can't continue just yet, especially in Illinois, because we have not been cleared to have more gatherings of more than 10 people. So we've had to cancel, all in all, almost 9 classes if you want to include the quality training. So cancellations here in the States and Canada and Australia. And so we're trying to make all this up. We have confirmed dates of September in Chicagoland, July in Chicagoland. We added a class in Guelph, Ontario, French-Canadian class in Montreal, and then another class in Australia. Tentatively, we're looking at adding more classes in September and December. So we know we need to get these auditors. So we had to pivot quickly as well. And what we developed is virtual auditor training. And this is not a webinar. It's not you know, it's virtual instructor. So it's not an online class. It's not a webinar. This is over the internet instruction. So there's a lot of activities. So we took our face-to-face and incorporated into virtual instructor training. And so it's not, again, I keep emphasizing, it's not just the instructor telling everybody what to do with no interaction. There's still activities that need to be conducted. There's a lot of information that is shared. And so this is just our, the SQF training. Lead auditor training is not a part of this. And instead of having 3 days of 8 hours a day, it's 3 days over 3 hours, plus there's a lot of intercession work, a lot of homework there. So it's pretty in-depth, and it goes quickly at our inaugural training a couple weeks ago, and we're moving forward to offer more virtual instructor training as well. And we're actually looking at adding the virtual packaging auditor training, so the course just for packaging auditors, and that's hopefully will be developed and implemented in July. So just to kind of give you an idea, I talked to some of the CVs, and they shared with me what their best practices are for conducting the audits. And what the auditor can do in order to make sure that, they're following the site protocol. We're in just, I keep using the term unprecedented, but, we have to act with caution. So, just making sure that the audit can continue. So audits are still continuing. If it's safe for the auditor, if it's safe for the site to welcome visitors, then the audit can continue. There hasn't been we haven't discontinued audits or put a hold on audits, but the audit can continue if the auditor can travel safely there. Many times they're saying, CBs are saying, as long as they're not flying there, not because of the risk to the airline, but sometimes airlines will have a flight and then cancel the flight. So they just want to make sure that the auditor can get there. And then if the site policy permits that as well. And then the site has their specific obligations in communicating with the CB regarding their visitor protocol, especially for the auditor. Is there PPE that they need to bring, their own specific PPE, a specific type of mask or gloves or booties or whatever it might be. And to even notify if there's any positives of COVID-19 on either end, whether it's the auditor or whether it's the site, to make sure that there's good communication between the site and that the auditor is aware of any of those behaviors that they have to follow ahead of the audit itself. And the auditor has their responsibility as well. Specifically, like I said, if they're testing for COVID-19 for themselves or anybody that they've been in contact, making sure that they have the right PPE so that they can effectively conduct the audit, minimize close contact, and really not bring in these personal effects to the site, bags or anything like that, and keep it all in one designated area. And it's important that the auditor is particularly organized to make sure that there isn't, like I said, to minimize that close contact in small spaces. There's always that conference room meeting and that. And then also for the auditor, where some CBs are suggesting they bring their own lunch and beverages, so there isn't that transmission and sharing of potential contact. And then, again, I keep emphasizing taking those necessary health precautions regarding their PPE. So bringing their own masks and their own gloves and making sure that they have the right equipment and not counting on the site. But there has to be, bottom line, great communication between the site and the auditor regarding any concerns, because when we're prepared, we feel more comfortable. So basically, the CB, the site can check with their CB regarding what those protocols are. And the CB should have a response to you, should be able to provide you with what they're doing and how they're training their auditors to conduct audits during this time. So preparing for the future, I know what we need to do. We need to credential more auditors, basically for this influx of audits that we'll be getting. We are removing the GFSI knowledge exam requirement. So GFSI has removed that from their criteria, which allows SQF to remove that requirement from our auditors. We are just have to sign some paperwork for GFSI and we'll send it in and we're good to go. So that should be completed by the end of the week. We need to modify our witness auditor requirements to get auditors ramped up more quickly. So we will, reduce the number of witness audits. We'll accept other CB witness audits. We're looking at that in particular. And then also using, like I said, virtual instructor training for training of auditors. And then we have to modify the audit process. We want to revise the audit report requirement to minimize the sectional summaries. And there's 44 sectional summaries in Module 11, 41 in Module 2. So can we condense these sectional summaries to make it easier for the auditor and make that part of the audit process shorter, so to try and prevent audit fatigue and audit burnout. Use remote technology, and I'll talk about that on the next slide. We're allowing auditors to audit more consecutively. So right now we currently, or prior to the pandemic, it was 3 audits, and then you have to bring in a new auditor. We're allowing that auditor to do 4 audits in a row now, and then obviously waiving that unannounced audit requirement. So remote audits. I don't like that term, remote audits. I think a better term would be the use of ICT, and this is how IEF looks at it. It's the use of information communication technology. And so with this, it's already in line what we do for our initial certification document review. So some of you that are already SQF certified, you know, I already did that. I did a doc review with my CB. I had to send them some documents. They reviewed the documents and they came in. So, information communication technology would incorporate Skype or Teams or Adobe, whatever platform you're using. Would look at records and checks and logs. Would look at policies and procedures. Even conduct some interviews for this. And you can even perhaps the auditor might say, take a picture. I want to see a picture. So we're opening up the spectrum of technology that we can use to incorporate at our audits, and at which stage can they incorporate this technology. In the beginning, in the middle, and in the end, really, is to how information communication technology can really be utilized within the audit. So GFSI is now in discussion as to how all the standard owners can incorporate this within their requirements. There's IEF documents on this that goes into a lot of good detail, from the IEF MD4, which is the use of ICT, as well as the IEF Food Working Group Task Force regarding remote auditing activities for accredited food safety certification. So there's a lot of good pieces of information that we're tagging to. It'll be applied to all audit types: initial, surveillance, and recertification audits. The timing between when on-site and remote audits, that's really to be determined. So when can you start remote activities to when the on-site audit can be. So it's not going to ever be 100% remote. There is going to have to be an on-site visit to check the inspection, to check the condition of the site. You can't do that through remote technology. Basically, what we're looking at is just really determining the feasibility of how remote audits can be conducted at the site. Is there internet connection? Do they have the technology available? Has the auditor been trained in how to use it? And then planning and scheduling the audit. When will the remote activities be included? Conducting the audit using ICT as well as those on-site activities, and then using ICT to close out. So some of you as SQF certified sites are saying, this is nothing new, really. Why can't we do it now? Well, the limit really is GFSI allowing us to do it. And as soon as GFSI provides us that go-ahead, we'll be ready to ramp that up. So we have another poll for you, and I think Kathy's going to pull it over, is, so what is the biggest factor SQF could implement to assist in controlling? Use of ICT, train more auditors, use of ICT activities, modifying the audit report, or anything else. Just chat that in. Yeah, ICT, it seems like that's really what is going to help us in how we can control audits. And then there's one more audit, so we can close this one and then pull over this other one here. And basically, I would like to get your idea is, how would you be willing to share your documents if ICT was used? Because this is the key to the remote audit, would you be willing to share these documents over a secured platform, of course? And it's so about 80, so we've heard the opposite. So it's funny because before this pandemic, we've heard many sites saying, no, we would never want to do that. But now it seems like this is something we need to do. So share but not send them? Okay, definitely. So that's good to know. Okay, good to know. Excellent. With the NDA, yeah, of course there would have to definitely be some protocols there. Okay, we'll slide that poll over. Okay, so now I'll close it because I know there were some questions about unannounced audits, and I can go back there, and Kathy, you can pull that other poll over. So I just wanted to share with you two things. Number one is the SQF conference is going to happen. It could happen virtually. It could happen in person. It could happen a combination of both. We really don't know yet until we're moving forward with it regardless, whether we're still going to have this conference. Primarily, this will be about Edition 9. So Edition 9 is coming out in October, and it will really be focused on Edition 9 and the activities on Edition 9. So hopefully you all could go. So are you planning on attending the conference this year regardless, whether it's in person or, I guess, yeah, in person or virtually, I guess. Haven't decided. Oh, that's a good mix, 30-30-30, it looks like. The other thing I want to bring to your attention is the SQFI Quality Achievement Awards. That's going to happen again regardless. So there's two awards, SQF Practitioner of the Year, SQF Auditor of the Year. So you can nominate or you can self-nominate by June 15th somebody that would be the Practitioner or Auditor of the Year. So please go to our website, sqfi.com. If you go to the SQF conference, all you have to do is SQF conference and then click and find the program, and you'll be able to find out how to submit for Practitioner or Auditor of the Year. So even if you've submitted in the past, feel free to submit again. I know we have some outstanding auditors out there that have not won this award that deserve this award, and same thing with practitioners that have not won this award that deserve this award. So you have to submit your nomination by June 15th, and then the supporting documentation should be submitted by June 30th. So there's like a letter that you have to submit and references you have to submit, but all that isn't due till the end of the month, but your nominations are due by June 15th. So if anything, go to our conference website just to kind of get an idea of what the conference is and where it's at and what our policy on COVID-19 is, but more importantly, go to the conference website to find out how you can submit a nominee for either Practitioner or Auditor of the Year. And with that, I want to thank you all for your time. I know I've peaked at 2 p.m., but I think we can stay on if everybody wants to stay on for a few extra questions. So I know that I see that there is some questions regarding unannounced audits. So I will talk about that. And the question is, it's unclear if they don't have an unannounced audit this year, will they have an unannounced audit next year? So if you are scheduled to have your unannounced audit with this in this year prior to August 1st, if your audit is scheduled to occur prior to August 1st, the unannounced audit requirement has been waived. And that means that you then would have to, if it's your last year of your unannounced audits, you know how you have your 3 certification cycles. This is the last year. Next year, you will need to have your unannounced audit. That's the policy. So yes, if you are scheduled to have it this year, your unannounced audit, and your audit is scheduled on August 1st or before, then your unannounced audit is automatically waived unless you're saying, I don't care, come on in with an unannounced audit. That's completely up to you, but you have the option to waive that as a site. But then if this is your last year, then next year is when your unannounced audit would begin. After August 1st, we'll reevaluate our policy. Honestly, we'll probably reevaluate our policy come July to determine if this is something that we need to continue. So we've already modified our policy once. It was like May 1st, and then that wasn't going to happen, and so then we pushed it to August 1st. So after August 1st, or probably in July, we'll definitely give sites at least 30 days notice that their unannounced audit would be waived. Because of that, because of the pandemic. We understand, just understanding the protocol that sites have to go through and the communication, it'd be very hard right now to have that as an unannounced audit. So we can very much understand that and don't want to put any more stress on the site itself. So we've taken in all of that. Other question came in is the re-registration criteria. Excellent question. Is that changing? I'm not sure if the question is it changing due to the pandemic or if it's changing due to Edition 9. Maybe it's a little bit of both. So due to the pandemic, the auditor requirements actually have changed. So for auditors, you do not need to have the 6 audits. Instead, we are allowing 3 SQF audits, and then the other 3 can be from any GFSI standard itself. So we did modify that requirement. For Edition 9, that is up for question still. So I can't tell you yes or no. More than likely will change for auditors, consultants, and I can't speak for Christy regarding trainers. So, but that has changed, and so for auditors, that has changed due to the pandemic. Any other questions? I'm trying to think. I don't see any other questions. Christy, are there any other questions? Okay. Oh, maybe one more. Okay. So we did get a question about Edition 9, so I can kind of go over just real quick Edition 9. So Edition 9 is going to be released in October, and it will be released in October. Public comment will be in July, so keep an eye out for public comment in July, and you'll have a way to have your voice. There is one question for Hillary regarding the resources. Are there any resources specific for the SQF certified sites? Are there any documents for site food producers, I guess?
So for SQF certified sites, not specifically, but because SQF certified sites are food producers, manufacturers, processors, the information that we came up with for the Food and Beverage Issue Alliance would be 100% applicable for SQF certified sites to use. So I would say look at those, and then the information that SQF has in terms of dealing with your SQF certification, if you want to do a risk assessment and ask for an extension, then that's where you would go for that information. But because you're in the food industry, because you're essential, and kind of dealing with all of the other partners in the food industry, the information coming out from FCIA that's on the website, feedingus.org, is going to 100% be appropriate for you.
And that's on FMI's website?
We link to it on FMI's website, so there's a lot of resources on FMI's website, but the specific resources for the entire food industry that we've kind of all collaborated on together. So it's like all of the food associations came together and said, this is how we're going to handle if an employee tests positive. This is how we're going to handle contact tracing. This is how we're going to handle employee screening. All of those are on feedingus.org.
Okay, thank you. Feedingus.org. All righty. Thank you so much. Yeah, it is a very handy resource guide. I couldn't remember where it was located, so thank you for that. Yes. Like I said, go to FMI's website, or you can link it through SQF's website, so SQF and then to the FMI resources, so a lot of good. So another question came in regarding does it, within SQF, is COVID-19 policies required within crisis management planning? So for crisis management planning, is pandemic required in there? So right now, we don't require anything in particular in there. There's a lot of examples because it really depends on your operation, where you are. You're not going to require hurricane relief if you're in the middle of the country. So it really is dependent on you. But based off of this current crisis, I would imagine that everybody would be looking to add pandemic as to part of their crisis management planning. really you're looking to determine, to make sure crisis management really is how it is in SQF. Just to give you the intent behind that is there's always a potential for a crisis, a fire, a flood, a hurricane, a pandemic. It's how the site handles that crisis, number one, but how they can maintain food safety and how they are evaluating their policies and procedures to ensure that the food that they're producing is still safe. So pandemic in this case, your potential threats could be, like I said, the use of temporary help, the use of different PPE, the use of different sanitizers. So this would then have to be evaluated to determine ensuring that the food that you're producing is still safe. So in the case of a fire, you absolutely need to make sure everybody gets out safe, but in the end, it's how are you handling the food to make sure that that food isn't going to be distributed into commerce if it's contaminated or at risk. So that's how it would be. But there is really, it depends on the site and what their potential threats are for the crisis. So that's how it's handled in the SQF code. And then, I don't know, perhaps Hillary, you can handle this, is what is the site responsible for if someone tests positive at their site for COVID-19? Is that in that document, how to handle a positive case for COVID-19?
Yes. So it's in the document in terms of how to handle a positive case. In terms of, I'm kind of reading into the question a little bit in terms of reporting. We've had a lot of questions about kind of what the required reporting. The answer to this question is going to be highly variable. So the answer is really it depends on what your local, state, federal requirements are, what country you're in, what mandates are in terms of how you have to handle it. In the United States, it's going to be variable depending on your city, county, state, on how you handle it. I would say in general, notifying the health department is probably the appropriate way to go. But the illness is, in the United States, the illness is reportable from the health department to the CDC. It is not necessarily reportable from the employer on up. So, but there's a lot of nuances to that, and it's going to vary greatly among jurisdictions. And then if you go into a different country, the rules are going to completely change. So it's going to depend on where you are and what that answer to that question is going to be.
Right. And then, so you need to talk to your local health department, bottom line. They're a great reference as well.
Exactly. You need to know what the rules are, because some countries have mandatory reporting and you have to tell all kinds of people. So it's going to be very different, and I just see someone saying in the chat box that it's different in Canada. So it's going to be very different depending on where you are. Domestically, internationally, and you just basically, one of the requirements of SQF is that you comply with all local, state, and federal rules. I would say it's the same with this. You just need to know what the rules are based on where your facility is.
Yep, thank you. Also, just as an FYI, if you go to the links next to the chat box, there's a links to web pages, and you'll see a link called Conference Survey. And if you click on that link, there's a survey to the SQF conference that asks more than just if you're coming or not. So there's a lot of detailed questions in there, and you can help us shape the conference for in October. So if you just have a couple moments today to take that survey, we're closing the survey tomorrow. So if you could just take I'm sure it's less than 10 minutes. I know how our team is. So less than 10 minutes just to provide your thoughts and feedback regarding the conference, that would be fantastic. So thank you. I think that's about all our questions. There's one follow-up question regarding the GFSI knowledge exam. So the GFSI knowledge exam is going to be done. So GFSI is no longer requiring it. So just to clarify that, GFSI is no longer requiring it. Therefore, SQF will not need to require it. We do need to sign a document, send it back to GFSI, and once we do that and they receive it, then we are good to go and we can notify Exemplar Global, and we do not need to require that. All the applications in the queue right now that have been held up because of this knowledge exam will then be released, and I will let Erin at Exemplar Global know that, and she will just contact you all. So it's not Exemplar Global. We are waiting on GFSI to accept our sign sheet or whatever it might be. Yes. Let's see. I think that's it. Just one question on follow-up. Crisis management is the only area of the code that addresses a pandemic. Pretty much that I can think of as it relates to food safety. So yes, from what I can think of off the top of my head, yes. Crisis management is the only area of the code that addresses a pandemic. All righty. Well, we went over our time, and I appreciate everybody sticking around to ask all these amazing questions. And if you have any other questions for myself or Hillary, feel free to send us an email for SQF. Our general inbox is info@sqfi.com. So you can, if you forget how to spell either of our names, but feel free to email us with any questions. I hope you found this webinar informative and helpful. I just wanted to share with you all the great work that FMI, especially Hillary and her team, have been doing during this crisis. It's just an amazing and outstanding job. So I kind of wanted to showcase Hillary and everything that she's done to make our industry safe. So thank you for all of that, Hillary. And then I wanted to also tell you all the work that SQF has been doing in order to support the SQF certified sites, provide you with any information, and try and make this this time easier for you. So with that, I will say goodbye. Please be safe, everybody. I hope to see you in person soon. So have a great day. Thank you.